this is one of our patients with kwashiorkor, a type of malnutrition, severe malnutrition. He's got swelling of his whole body. This is how we're doing rounds right now. This is MA. Say hello, MA. Bonjour. The MA is one of our nurses, and this is Jean. She's she's a visiting medical student. As you can see, he's got swelling on his whole body from malnutrition. He's had lack of protein from not having enough protein, so his whole body is swollen. And you can see when I'm pushing his foot here, you can see how there's a big dimple that's made. So that from the lack of protein and all the swelling all over his body. So we're treating that with a special formula we get. You can make it here. We actually now have received some from the World Health Organization. So we're able to give him that through that. He's not able to eat on his own, so we feed him through this feeding tube. So although he doesn't look as malnourished from a weight standpoint, he's very malnourished from a protein standpoint, and that's why his whole body is swollen like this. This is a little boy named Abubakar. He came in with really severe malaria. His blood count was so low he almost died. So we did an emergency blood transfusion when he got here. He's doing a lot better. He's still got a high fever from his malaria, but he's much better colored than he was yesterday. He came in completely white. He's got a little bit of pink there now. So he's doing a lot better. Aruna came in with a Burkitt's lymphoma. It's a mass that had gone up about this big around his head. It was into his mouth, and he couldn't close his mouth anymore either. He had it in both kidneys, and also in his leg. He couldn't walk anymore. And we did 9 cycles of chemotherapy here, and now he's cured. He's got his jaw's a little changed shape just because it was pushing on his jaw for so long, but he's cured. Now he's just scared to come back and visit because we stuck him so many times with so many needles that he's just afraid to come back and even visit, even though we told him we're not going to do anything to him. You gonna be a doctor now? Ibeke doctor ye. Odo? Ikane forake. Ante foike. Ya famu? Ambe ikanu drone. The doctor's job, right? To delegate all painful procedures to nurses.
That's right.
So this is one of our preemies here. She was born 2 months early at 32 weeks. She's doing a lot better now. I think she's 4 or 5 days old now. Every day she's doing a little bit better. She's really having trouble breathing from her premature lungs. Here we don't have ventilators. And babies' chests tend to collapse when they try to breathe, preemies especially. So we use this tape and tongue blade method to pull their chest up tight, so that when they breathe, instead of their chest collapsing, it helps their chest stay out. And if they really have trouble with their oxygen levels, we'll pull it even tighter and help to raise their chest up. So it keeps their chest inflated better, like an adult would when they breathe in, their chest gets bigger. But she's breathing a lot more comfortably now, and she's doing really well. So we feed her through these little feeding tubes. Since she's not able to really suck and nurse well and gain weight that way, we feed her through these feeding tubes through her nose into her stomach, and we pump the mother's breast and give her the breast milk like that. These homemade incubators are really nice. We use light bulbs in here to provide heat, and just close in. So it's a lot easier or a lot less expensive than buying expensive American incubators. And also, when it breaks, we can fix this as opposed to an incubator from the States that requires a part from the States that would be hard to get.